guys, how you doing today? Here we are at Vegas Direct Primary Care with my friend Dr. Hakimi, and we're gonna go in there and have a little fun, and then we'll see if she's up for like a little 15-20 minute discussion on what makes her different and unique in the community versus your average hospital doctor. So let's go. Hi, how are you doing?
Nice to see ya.
You too. I saw your sign out there, and I haven't been feeling well, so I was hoping you could see me.
Yeah, definitely. It's my pleasure. So, what seems to be troubling you today?
I've been having a little bit of shortness of breath, but I don't know if it's, what's going on around.
Yeah.
Well, there's always something wrong with me. So between all the surgeries, but I'd say right now it's just shortness of breath, and I know we're getting close to flu season.
Yeah.
And stuff like that, and I don't know, I just want to be careful.
Okay. Well, welcome to Vegas Direct Primary Care. My name is Dr. Hakimi, and I'm actually a primary care physician, so I do think I can help you.
Okay.
Do you have a primary care physician right now?
I don't know. I'm leaving the Air Force, and I am in a new job, and I'm going to be disabled vet, so I probably have lots of coverage, but I don't know who's going to be taking care of me.
Right. So first of all, thank you so much for your service. We really do appreciate you for everything you've done. What we do is basically prevention and making sure you stay healthy. So your insurance is important, but we don't take insurance. What we do is a flat monthly fee for all access care to me, a physician.
Okay.
So the problem is right now everybody thinks that healthcare insurance takes care of you, but they don't. We do. Right?
Okay.
So that's the concept of direct primary care. The relationship is directly one-on-one with your physician, and you can call me, text me, email me, come see me whenever you want. And it's literally a flat monthly fee. It's kind of like Netflix of healthcare.
Oh, I like Netflix of healthcare.
Yeah.
Okay.
Yeah, so we would definitely love for you to come on board. So if you'd like, I'll send you a patient agreement, and you can get it signed, and we'll start ASAP.
All right, let's do it.
All right.
Hello, YouTube. Welcome to Kicking It with KJ, first ever waiting room talk. I am here with Dr. Hakimi. I met her through Leadership Las Vegas, and she is so awesome because she was willing to participate and hang out or kick it. I get
Kicking it, yeah,
kicking it, right?
Absolutely.
And so I want to throw this out there that we did do a little skit before this. It is all an act. So please, no judging, even though people probably will judge anyways, right?
Yes.
So anyways, let's tell everybody about you. I mean, this is about you,
awesome.
not me, right?
No, it's about both of us. So Leadership Las Vegas brought us together, and I met this amazing gentleman, and he's starting to do his thing, and I wanted to be a part of it because this is such an amazing podcast and everything. I want everybody to be involved. So for me, I'm just a family doc that decided to go off on my own and started my own practice. The world has changed. Healthcare has changed. I felt that I could make a difference by going off on my own because that's the most important thing. I was put on this earth to help people, and unfortunately, we discussed this. Our healthcare system is a little broken right now, so
Right.
I've had to do what I needed to do to make a difference. And I think that's what we also share through our experiences, and especially with leadership, is that we're all trying to make a difference in this world, and this is my way of doing it.
Yeah, there is definitely what I'd call a calling. I think some of us, it's in us to serve and want to help.
Absolutely.
And so it's when I heard about it, it was weird because I remember seeing your flyer.
Yeah.
And I was like, man, medical is not that expensive.
Right.
I was like, what's with this $6,000 ambulance ride I took before?
That's right.
And Uber is cheaper, right?
That's right.
So, tell us, so what do you think motivated you the most to make that shift to your business model, and how have your patients responded?
Yeah, excellent question. So the premise of care that I'm practicing now is called Vegas Direct Primary Care. And the reason why it's called direct primary care is because we have a direct relationship with our members. So I don't call everybody patients because you're not sick. And what my goal is to keep everyone healthy, because as a primary care physician, we were trained to keep people healthy. We were trained to do preventive medicine. And unfortunately, in our current system, we aren't able to do that. There is no quality associated with you seeing me for 10 minutes. I can't even practice the art that I was trained in for 14 years in 10 minutes, right? So that was my final, straw that broke the camel's back. Doing this assembly line medicine, knocking people out every 10 minutes, that's not quality of care.
Right.
And nobody deserves that, especially in the United States of America. It's the best country in the world, and we have access to everything, but our system has really gone askew. And as a physician, I've seen it change. I've been practicing medicine almost 20 years now, and it hasn't changed for the best. I think the biggest problem is that we have a model now that dictates that a company takes care of you. And it's not a company that takes care of you. It's us, your clinicians, that take care of you.
Got it.
So what we're trying to do is take medicine back. That's my hashtag.
Take medicine back.
Yeah, for sure. And we want to do that because we want to be able to practice real medicine like we were taught to practice.
Right.
It's not just you guys that are frustrated with the system. We absolutely are too, you guys. It's not a good system. So honestly, after I did leadership, I finally decided that I'm not going to complain. I'm actually going to do something about it. So I created my own practice. I've been around for about a year and change.
Right.
And I have about maybe 150 members under my panel.
Okay.
And it's been amazing. I mean, honestly, I'm so blessed. I feel like I'm going to cry because it's been so amazing. Because I get to be a real doctor again. And it's such a good feeling. And it's awesome because my members, literally, they will check in on me, even with all this stuff that's going on with COVID right now. They'll check in on me and be like, hey, doc, are you doing okay? Is everything okay with you? Like, who does that?
Yeah, and
who does that?
Well, so seeing you get emotional tells me that there's some connectedness with what you do and your patients. And one of the things I used to always get frustrated about as I retired from the Air Force, right, is there was no continuity of care.
Yes.
And so I never got to see the same doctor, and I'd be frustrated that I'm explaining,
over and over.
I just explained this the last time.
Yep.
And you don't, and it felt like it was always like take one step forward, 3 steps back. And the thing is the doctors, they would take the thrashing.
Yes.
So it's like you said, I get to be a doctor, and it's like it's me who's taking care of you.
Yes.
It's not the institution or the hospital, or the administrators who are changing policies.
Absolutely.
That just, the trickle down effect is the patient is the one who suffers.
That's right.
And what's the priority here? We took an oath, right? Just like I took an oath, right?
Absolutely.
The oath is to take care of them.
Do no harm.
Right? And I like that, right? So COVID, right? We talked about it. COVID had some significant impacts to everything in Las Vegas, right? We have the strip out there, we have health, and we learned that in leadership, right? I grew up in this bubble of like military for the most part, and then I get to come out here and be like, holy smokes, there's business, there's banking, there's nonprofit, there's medical, there's health. And then when we went to that the health day, and I was like, hey, I need to see you. I got all these aches and pains, right? But COVID, like, how would you say COVID impacted you for the better, the worse? And with flu season coming, and I looked at your page, and you actually talked about with flu season, because I'm worried about that, right? I'm worried about not knowing the difference.
Yep.
How would you say that has impacted you?
So flu season is going to make it extremely difficult for us in terms of differentiation of what viral process is going on in the body. And unfortunately, we do have a lot of misinformation out there, you guys. And doing this practice, I get to also be a healthcare advocate. So when people do have like these questions about what is the right thing to do for them, they reach out to me as well. Because the last thing I want to do right now, KJ, I don't want you to Dr. Google anything. Please, for God's sake, anybody can write in the internet anything they want. Don't Dr. Google it. That's what I'm here for. That's what I went to school for. Like, I can't do what you do, and I would definitely come to you when I needed your help. So, unfortunately, people have been trained differently now. They Dr. Google everything. The flu virus season is going to make it extremely difficult for us to differentiate what's going on in terms of the COVID and the flu. So we absolutely advocate everybody at least get the vaccine. But the problem is there are so many different types of influenza virus too.
Right.
So the one that we're vaccinating for is the one that we think, the epidemiologists believe, is the most detrimental one for our overall well-being.
Okay.
So at least we advocate people get that vaccination so that it will help us if they do get sick to hopefully think that, at least they've vaccinated themselves against this one virus. So for me as a direct primary care physician, because I do something very different, I just do the flat monthly fee, right? So it's kind of like the Netflix of healthcare.
Okay.
So you can call me, you can text me, you can email me, you can come see me. We don't have as much office hours right now. We do a lot of telemedicine.
Right.
And then I also do house calls. I'm old school. I'll even come to your house.
Okay.
So the thing about the COVID situation is that we're using more of the telemedicine platform. And because I'm not a fee-for-service doc, which means, every time you walk in, I get paid, that's why you keep having to go back every time, because that's how they get paid.
Right.
Right? So I don't deal with that model.
Okay.
And all I want to do is just be a physician. I'm not a biller, I'm not a coder. I wasn't made to do those things.
Okay.
And so with this model, COVID, honestly, knock wood somewhere, you guys, superstitious or whatever, it hasn't really affected me. It's actually caused me to be stronger. Thousands of people in the healthcare world have been laid off with COVID.
Okay.
I think you've heard that.
Yeah.
Hospitals laying off all of their clinicians pretty much, and down to the bare minimum and things of this avail, because the system is harboring a system where it's a fee for service. Like, if I don't do something and see a patient, then they have no use for me and they fire us.
Oh, wow. Okay.
Right?
Yeah.
Unfortunately, when you're in an environment where you're replaceable, in that big model, corporation model, everybody's replaceable.
Right.
Even us. Which is really hard to understand. I mean, even if you go to, I've gone to like 40 different countries, honestly, and I talk to people all the time about their models of care all over the world. Nobody practices the way we do, and they are absolutely mortified at some of the stuff that we do. So it didn't used to be like this, but like I said, I got tired of complaining, so I created my own model. And then the other platform of direct primary care is the reason why healthcare is so expensive is because there's so many hands in the pot. There's so many chefs in the kitchen.
Okay.
Right? So with this premise of care, some of the aspects of the membership is that, first of all, I can order labs directly and they bill me, so that gets rid of the middleman of somebody hunting down people for their copays and deductibles.
Got it.
And I can get a complete set of labs for pennies. Listen to me, pennies. Even when I found out about the price model, I was flabbergasted.
Yeah, I remember
I
that
was
stuck with me.
flabbergasted. I couldn't believe it. The other premise is also that because, once again, we go directly to the centers in terms of imaging.
Right.
So God forbid you do break your leg or your back goes out again, all of these things. And we need imaging, right? The model that we have now, there's all these copays, deductibles, pre-authorizations, pre-existing conditions, and time, more time. And none of that is medicine. That is not quality of care.
Okay.
That has nothing to do with us giving you care. So we remove that aspect. I can literally order an x-ray tomorrow for about $25. That's including the read from a radiologist, a professional. I can get an MRI for probably less than $200.
Yeah, all my bills said it was in the thousands.
Because that's a game that they play.
Okay.
That's the game they play. Because the current model, so you guys, I'm not bad-mouthing insurance. You need insurance. Insurance was made for emergencies. It was made for catastrophes. Like, do you use your car insurance to put oil in it to maintain it?
No.
No. Right? So what I do is the maintenance part, make sure that people stay healthy.
Right.
That's primary care. Insurance wasn't made for that. Insurance was made for, the broken bones, the blood transfusions, the catastrophes.
Right.
So this model of care works well with a very high deductible plan.
Okay.
And preferably an HSA that you can also use, right? So if you have a direct primary care physician as well as a very high deductible, you're covered. You've got TRICARE, and you're going to be working with the VA and things of that avail.
Right.
You honestly have that portion already there for you.
Got it.
So what you just need is amazing primary care to keep you healthy,
Got it.
give you that quality of life that you need. And that's our forte. Like, I literally, you can ask my members, and you know quite a few of them.
I do.
You can ask them. Like, I will call you out. What did you have for breakfast? What did you do today? Did you get on a treadmill? Did you exercise?
Yeah.
Did you get your 8 hours of sleep? I want you to stay healthy. It's the basics that I can do now to keep people healthy, because the body is amazing, and you know this.
Yeah. Well, I just pleaded the fifth 3 times when you asked me those 3 questions.
He didn't even look at me, you guys. He looked at my shoulder. He didn't even look at me in my eyes. He looked at my shoulder.
So I did work out. I had a protein shake for breakfast, and I did not get 8 hours sleep because the little one.
Of course.
Right.
So adorable.
Okay.
Yeah. So cute.
I got in a debate on Facebook.
Okay.
Right, and I don't know, but I know that you earlier said there's a lot of misinformation out there.
Yeah.
And this is probably not a subject matter expert, but you would be more of a SME than I would, right? And so there was a lot of concerns or questioning on COVID-related deaths and how many were actually COVID versus, and then a lot of memes came out, right? And it shows like the doctor and the nurse talking, saying, so what happened to this guy? And she says, oh, he was in a car accident, COVID.
Yeah.
Right? So do you have an opinion or a thought on that? Or have you had any discussions with people about that?
So the thing is that you guys need to realize how we fill out death certificates.
Okay.
That's kind of where all of this data is coming from. Most of these numbers that are coming are based on the various testings that we're doing, but that 6% number that came out was based on death certificates. So on a death certificate, there is a primary cause of death that we have to indicate why that person died, pretty much.
Okay.
And it could be anything from, their heart failing, their lungs failing, their entire organs failing, and things of that avail. And then underneath that, it has to be, reasons why, pretty much, right? So I think what happened is that if it had happened in terms of, something happened to us and we're relatively healthy and we have no other medical conditions, as a clinician, as a physician, I would have no other causes other than COVID to write down for cause of death if somebody dies. Right? If you don't have heart disease, if you don't have lung disease, if you don't have a cancer, if you have nothing else going on, fortunately, on that death certificate, I would have to write COVID as the cause of death. Right? And the thing is, COVID actually kills more people with various medical conditions.
Got it.
Right?
So it could be more than just COVID.
Yeah,
right?
exactly. So we're not going to necessarily say COVID is the primary reason.
Got it.
Because COVID could have pushed them into, finally having multi-organ failure or an inflammatory response that caused their congestive heart failure to go bad, or someone that was a smoker all their lives and now they've got chronic lung disease to go bad, and then you throw COVID into it, boom, all of that just went bad.
So how did that get confusing? Do you think that was an ethical thing based on, that's a loaded question, I know. I mean, I think,
unfortunately, Kevin, right now we have a lot of the healthcare aspects being politicized.
Oh, got it. Okay.
I think it's a lot of those numbers are being politicized. So they are being skewed to whatever benefits.
For a narrative.
Right.
Regardless who, right?
Regardless
who.
Numbers, all of these things. And honestly, a lot of our numbers are not accurate because there's people that live on the streets. There's people that don't have social security numbers and they don't get care, and so we're not counting everybody anyway. So from a physician's point of view, that's the interpretation of that we can think of. By no means should we take this virus lightly. Still, we have over 200,000 deaths in our country right now. That's 200,000 too many. For anybody to think that, well, we have so many millions of people living and 200,000 is just a minute number. It would not be a minute number if that was your mom, if that was your sister, if that was your brother, if that was your child. So we don't discount any lives. Every life is very important.
Yeah, I've seen, like, and not to deviate away from the healthcare talk and the fantastic service you provide, but I've watched a lot. You've seen that open up on social media a lot, to where people can be very dismissive of something when it hasn't impacted them direct.
Yep.
And, and it's like, I wish sometimes it was like, could you just put yourself in that position?
Yep.
Like, thank goodness you're not in that position, but imagine if you were. Would you care a little bit more, or would you, think a little bit differently?
That's right. And
I ended up watching more folks not even want to come to the table and just even have the discussion. And me and my Coach B, if you watch the podcast, that's my co-host. We always have this joke, and you probably heard us say, like, if you don't drink Dasani water, unfriend me. I'm just like, geez, like 98% of me and you think alike, and that 2%. Right. So now, and so, okay, I agree. I mean, I think people tend to be like, it's not impacting me directly, so why do I care? And then I do see these arguments that ensue, and I got in a debate, and it was good. It was weird. I think I misunderstood it, but it was about, the cause of death can be COVID and something else.
Mm-hmm. Absolutely.
And I had misunderstood it, and I was like, well, I actually misunderstood it as like, I was like, yeah, I'm starting to have my doubts that everything is just COVID related.
Right.
You know what I mean? And I think the CDC had pushed numbers that had kind of aligned with that. Because you got to look at, like me and my household, right? So, you have me. I'm considered high risk because of my sleep apnea, my respiratory problems.
Right.
I have my dad, who's a senior.
Yeah.
Right. We had Lynn, who was pregnant.
Yeah.
You had all of them.
And you had all of our high risk categories.
We had one big house of high risk, right? Yes. And I managed my PTSD by working out. Mm-hmm. Right. They used to try to give me the drugs, and I didn't like the way I felt. Yeah. And so they you got to cope somehow. And the gym is where I learned to cope.
Awesome.
And as I've gotten older, my body's not able to keep up like it used to. And
he's not older. I don't know what he's talking about.
As I've gotten older.
Not even older.
I know. Look, I did all that time military. My hair's not
gray. We got a nice haircut.
I did. That was from Stunna's. Like we have a video to put together for her too. I'm actually gonna get some braids.
Nice.
Yeah, I'm gonna enjoy life for a little bit, right?
Yeah.
And so I as soon as the gyms closed down, I was like, oh my gosh, and me and Jesse would work out in the back, and I can't. I don't know. I don't think you were in that Leadership Las Vegas Zoom. So I have to work out in a gym and walk around like an alpha male. So my workouts are better based on friendly competition. Like if I see a guy working out hard, then it motivates me to work out harder. Yeah. When I'm in my backyard, I'm just like, I'm good. Yeah. And so I was sitting on the couch. What do we call it? Marathon Netflixing.
Yeah.
Netflix, like just.
Yes.
Right?
Binging,
right?
Yeah.
But I was also binging in the pantry.
Oh no.
So that's where you'd be like, Kevin. So Lynn comes downstairs and she's like, hey, do you fit all those clothes that we bought for your transition to be a civilian? Right? Because I wore the same uniform every day, and we went out and bought all this clothes, and I said, I don't know. She was like, well, why don't you try it on? I was like, no. I was like, I'm not trying it on. She was like, that tells me you know.
Right.
And so what I did was I started going on these 4-mile walks, these power walks. Yep. I stopped lifting. My joints started feeling better. But as soon as the gyms opened up, I was back in there.
Yeah.
And so going back to what I was getting at is like, I found myself like, I know COVID's real, so please don't call me an idiot because I believe COVID exists. Right. But I got to a point where I'm like, we're literally one of the most high risk. I did all the shopping, and I'm in the gym. And at first, the gyms, the guidance was you just had to wear a mask in and out. Oh. But once you were in, you had to be 6 feet apart, but you didn't have to wear a mask. And then it gradually evolved into, I think when we went back from phase 3 to 2, or the phasing, they got stricter. And then I was like, look, I'll wear a mask just so the gym don't close. Right. But I struggle worse breathing in it. Well, besides that, it sucks into my face. And then when I exhale, all the lint blows up into my eyes. Right. But I started getting to a point where I was like, like, and I don't know if it's I'm doubting COVID or Kevin James just wants to get back to a normal, like, oh my gosh, like I just want to like hug people and talk to people, and
we all do. I mean, we do too. I mean, this is
Right.
very hard because you know me, I'm also super social, so it's been very, very hard for all of us, not just as a physician, but as, you know, a very social person. I don't know what normal will be for us in the future,
right.
but I think that we just have to be a little bit more patient. I'm hoping that a vaccine will also move us forward instead of backwards. I can't tell you when that's going to happen, but as a physician, that will give me at least a little bit of a peace of mind that, you know, if you do choose to do the vaccine, which we absolutely recommend, but you know, people have choices, then you choose to do what you choose to do. Right now we don't have a choice. We're kind of put in a situation where we have to do this to protect each other and to protect our loved ones, but hopefully with the vaccine we'll have a choice. Our new normal will be okay. It'll be better. I think that this pandemic has caused us to be more cognizant of our health and well-being, and hopefully for a lot of people to understand to make it a priority, especially your immune system. Your immune system is what controls your well-being.
Okay.
And I am on top of my members all the time. So out of the 150 plus people that I have on my panel, only one lady got it. And that was because she made some bad decisions, and you know, that happens. But I really keep on top of people in terms of their immunity. So I talk to them, like I said, not just about what they eat, what they drink, how they sleep. I keep them on top of different things in terms of, you know, what they need for their immune system to stay healthy. Okay. So I think that is the biggest key right now for our community, but for overall well-being, because a lot of the times when our immune system acts up, it causes inflammation. Inflammation causes disease, right?
Yeah.
And stress causes disease, and that's another form of inflammation. And when these things start to act up and we actually start to change our cells really badly, then we use really bad words like cancer, right?
Okay.
So our most important thing we can do is to make sure we give ourselves the basics in terms of food, hydration, nutrition, physical activity, all of those things, and sleep. Sleep is huge. So with this practice, once again, I get to be a real physician and get to remind people to do that. And I will hold you accountable. The current model doesn't work, right? If you come in and I just write you a prescription and tell you your labs look great, that's not good care, right?
No.
I literally will go through and tell you everything on your labs so you appreciate what your body can do for you,
right,
as well as the areas that you're lacking. So that's super important for your health and well-being. So the final premise of direct primary care is that we actually dispense our own medications.
Okay.
So we got rid of the middleman there. Not everything, of course, but blood pressure pills, cholesterol pills, antibiotics, anti-inflammatories, all of that I can dispense right here, so then you don't have to worry about going to the pharmacy. Once again, when we dispense our own medications, we go directly to the manufacturer, you guys. It's like 90% wholesale value. I can actually get blood pressure pills for 3 months for about $5.
Wow. My copay, that's my copay.
Right.
I mean, that's most of their copay, right? What's your copay, guys?
No, no, that's your copay. I think most copays are $25, $50.
Yeah.
And that I actually had this lady that has no insurance. Once again, you need insurance for catastrophes, but she didn't have any healthcare insurance. I don't know how she found me, honestly, but she basically has so many different medical issues. She has high blood pressure, cholesterol, lupus, rheumatoid arthritis, and diabetes. And I am actually able to get all of these medications for her for less than $200 a month.
It's pretty amazing.
Yeah.
Have you been so we know all these nonprofits from leadership.
Yeah.
Right? Like, has there been any connections or just like some St. Jude's or Freedom Houses and all that, and say, well, they have people there, like, who pays for their medical, or is there a better business model? Like, is your business model better and cheaper for them, especially when nonprofits rely on money and donations and grants.
So this is the biggest hurdle that I have, is that I'm kind of a one-woman show. There's actually 4 physicians in town that practice direct primary care, and we don't have that kind of marketing money because we're not these ginormous corporations. So we really rely on word of mouth and things like this to help us get the word out. So I've tried as much as I can to get out there and bring this model of care as a healthcare option. So you have two forms of people out there. So there's people out there that are like, oh, what's the catch? This is too good to be true. And the other one is, well, I have insurance. Insurance doesn't take care of you. We do. We take care of you. People have to start to understand they need to change that form of thinking.
So it's kind of like, you go back and look at what you're paying into your insurance and say, like, why do I need insurance for primary care? Like, and then you readjust it, kind of like I can have full coverage or liability and reduce my payments on my car, knowing that it's like, well, yeah, I own it, and as long as it's paid for, if it's not my fault, maybe that's a bad example, but I think we're getting to the point is like, don't pay so much for insurance when you can come in and pay way less, see me,
and actually get care.
And get care,
honestly. And access, That's the other problem. I mean, I think in our city right now, to even get in to see a primary care physician, so there's difference in training, to see a physician, it's probably going to take you at least 3 to 6 months right now to get in.
Wow. What's your wait time?
Tonight.
Like right now?
Like right now, tonight, I could get you in.
Yep, and that's right, because it's also not just in person.
Telemedicine.
Zoom.
So we have our own site that is HIPAA compliant that we do our telemedicine on. And I like to do my first visit on telemedicine because it takes about an hour for me to get to know you and what we need to do in terms of keeping you healthy. And then for the follow-ups, I usually have you come in and we discuss labs and things.
Well, you're saving people money there. Like, now I don't got to drive. I don't got to deal with this Las Vegas traffic. Because, I live in North Vegas. By the VA hospital. So if I wanted to just talk to you, that benefits me.
And there's an app on your phone that you can jump on too. So if there's anything in terms of, something comes up and you needed to talk to me in person, you don't want to text or call, or you had a funky rash or something that comes up, or you hurt yourself or
I've
whatever.
always got something going on with me.
So you would just text me, hey doc, can you jump on the app? And I just jump on the app and I'm right there.
I tell you, so I had this foot pain, Yeah, we might as well put this out there, because they're gonna be like, there's something wrong with this guy always. So I had this pain for about the last 3 weeks in my heel.
Oh yeah, plantar fasciitis.
That's what I thought, So I Dr. Googled it, Shame on me, So
yeah, flippity floppity.
So one, I'm not supposed to wear these, I'm not supposed to, but I love flip flops, And so my skin had been getting really, 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 really dry. And then I started feeling this bruised feeling the last 3 weeks. So last night, it's like, you're trying to figure out where the pain is directly, because I get a lot of muscle pain and trigger points to where, I tell the doctor, it hurts here. He's like, yeah, but the problem is over here. It really isn't here.
It refers.
It's referred, So I take my knife out last night, my very sharp switchblade out, and I start digging out where the skin is.
Surgery. Good job.
I did. It was awesome though. So and my daughters.
Kids, don't do this.
So don't do this.
At home, kids.
Do you want me to cut this part out?
Don't do this.
There's got to be some entertainment value, So my daughter, so she's holding the light and she's like, ooh, so she's grossed out by it. And we see some fluid start to come out.
Oh, wow.
And so I push and some pus comes out with a hair.
Oh, you had an ingrown hair in your foot?
So we think when I was cutting Charlie's hair, I stepped just at whatever
Who's
angle.
Charlie?
So Charlie is his brother.
Okay.
And
wow.
And it just got dug in, and it finally got to a point where it got infected. It was hurting. I wake up this morning,
You're kidding.
Like nothing's wrong. So that's not to take away. So
don't do this at home, kids.
So I think I literally just contradicted the whole point of this whole interview.
No, because so that's a good point, actually.
Right.
So then you could have just jumped on the phone and been like, "What's going on? Take a look at this foot," and then maybe I'd have you come in and let me do it, so that we make sure that it's hygienic.
But I'm also military, right?
Yes,
so we're used to like being Rambo and the the gunpowder in the wound and lighting it on fire. So
those were movies.
I know. So obviously I took it a little too far. But there's got to be some entertainment, like someone like, oh, and you reprimanding, you admonishing me for like, what are you doing, dude?
I would never reprimand. I would probably still laugh and be like, wow, like that's a great job.
But it gave me good father-daughter time.
Yes.
Right?
Yes.
So
now your daughter wants to be a doctor. Yay!
She wants to be a vet.
Oh, good. Even better.
Which is an animal doctor, right?
Absolutely, yeah.
And so we'll see. So I guess like I would end on this, right? And so is there anything that like what would you say to Las Vegas?
Mm-hmm.
What would be your I always tell people during my podcast, like, what would you tell someone, right? And usually something inspirational, or something like that. But what would your message be?
Yeah.
And then and where to find you. So you got to tell people where to find you and why to find. Well, you told them why, where to find you.
Okay, great. Right. So I think the message is that the system is broken. Our healthcare system is broken. We understand that. We get it, and we are just as frustrated as you guys are. But we're tired of complaining, and we're going to try to make a difference, and we're going to take back medicine. So as a physician, we have decided to do direct primary care. We want to have complete, quality, affordable, transparent care for everybody. And we want to offer this to everybody. And we ask you guys to give us a chance to establish that rapport. Let us practice medicine again. Get a feel for what real medicine is, because that's what we are able to do now. Give us a chance, give us a call. So my practice is called Vegas Direct Primary Care. I'm located at 2482 West Horizon Ridge Parkway in Henderson, but sometimes I travel too, remember that. And we do a lot of telemedicine. So my number is 702-829-0478, 702-829-0478. That's literally my cell number. You can call me or text me even if you just have questions about the practice. And then of course we're on social media, Vegas Direct Primary Care on Facebook and hashtag Vegas Direct Primary Care on Instagram. And finally, the webpage is www.vegasdpc.com. You can go on there and see all of the different prices and things of that avail, and we're always here for you.
Wow, thank you.
My pleasure.
So guys, I think the big thing that stood out to me was direct.
Absolutely.
Right, direct care, because I know I've walked in to many of my doctor's appointments and I'm like, one, am I going to see the same doctor?
Mm-hmm.
Two, am I going to be just prescribed Motrin again?
Mm-hmm.
Right? And three, I honestly had a lot of doubts whether it was going to get fixed. Right? And so I would say, if you've ever wondered, if you walk into your current medical provider and you ask yourselves those same questions, maybe give it a shot. Right? Because it's direct and it's not like, like you're locked in, right? I mean, like...
No, sir. Yeah.
You're not locked in.
No, sir.
So, I mean, I'll be honest with you, I'll waste more money on Taco Bell in a month. Right? Which is actually probably why I have inflammation and my lifting is not good. But, like, give it a shot, right? So, we're going to put our information out there. She's already told you, but we're going to put it out there at the end of the show. And, this is our first one with Dr. Ati Hakimi from Vegas Direct Primary Care. She is so awesome, and I am blessed to know her. And thank you for tuning in. Bye, guys.
Bye.